Hey everyone, and welcome back. I'm really excited for today's deep dive because, let's be honest, sometimes we all just need someone to sift through the mountain of info out there and tell us what's important, right?
You got that right. There's so much out there.
Exactly. So today we're diving into the world of AI and medical imaging. You sent over some research on this, specifically a paper called Large-Scale and Fine-Grained Vision Language Pre-Training for Enhanced CT Image Understanding.
Yeah, it's a mouthful, I know.
It definitely is, but it sounds super interesting. I mean, AI reading CT scans, that sounds like something straight out of science fiction.
It kind of is, but it's becoming more and more real every day. This paper is all about a new type of AI model called, get ready for it, fVLM.
fVLM. I think I can remember that. So tell me, what makes this fVLM so special?
Well, let's think about how traditional AI works for a sec. It's kind of like teaching a computer to read a medical textbot, but only showing it the pictures.
Okay, I can see where that would be a problem.
Right. It needs tons and tons of labeled data to learn, which is super time-consuming and expensive. This new approach, fVLM, is all about context. Imagine giving the AI the entire textbook, pictures, and text.
So it's not just looking at CT scans, but also reading the reports from the radiologists.
Exactly. And it's not just passively reading, it's actively connecting the information in the report to specific parts of the scan, which is super cool.
Okay, hold on. How does it even know which part of the report goes with which part of the scan? I mean, the CT scan is like this super complex 3D puzzle, and those reports can be pages long. How does the AI figure all that out?
That is a great question, and this is where this approach really gets clever. fVLM stands for Fine-Grained Vision Language Model, and it uses something called anatomy parsing. It's like a super organized chef prepping ingredients. First, it identifies all the individual anatomical structures in the scan, stuff like the liver, lungs, pancreas, you name it.
So it breaks down the scan into different organs. Okay,
Yeah.
that makes sense.
Exactly, and to do that, it uses this really neat software called Total Segmentator. Think of it like a master butcher expertly carving up the CT image into all its little parts.
I like that analogy. So how many parts are we talking here?
Well, Total Segmentator is pretty powerful. It can actually identify like 104 different regions in a CT scan.
Wow, that's a lot.
It is, but for fVLM, they actually grouped these 104 regions into 36 major anatomies.
Okay, so it's kind of simplifying things a bit, making it easier to manage all that information.
Exactly, just like organizing your spice rack, grouping similar spices together.
I'm with you. So the scan is all neatly organized. But what about the radiologist's report? How does the AI match the descriptions to the right organ?
Okay, so for that we have report decomposition. Imagine highlighting a complex document, marking the sections related to specific organs. They actually use a large language model for this. Think of it like a supercharged autocomplete on your phone.
Okay, I'm starting to get the picture.
Along with something called string matching. It identifies and separates the parts of the report that describe each of those 36 anatomies.
So it's kind of like a detective and a librarian working together, using high-tech and old-school methods to make sense of everything.
That's a perfect way to put it. But here's the thing. Radiology reports, they can be all over the place. Different structures, different terminology. So the researchers had to get creative to make sure the AI could handle all that variation.
Oh, I bet. So what did they come up with?
Well, think about it like this. You've got a crazy, complicated recipe, and you want to make sure you don't mess it up. What do?
You break it down into smaller, more manageable steps.
Exactly. That's what they did here. This divide and conquer approach helps them deal with all that variability and make sure the AI is connecting the text to the right anatomical structure.
So we've got the scan separated into organs. We've got the report color-coded to match. What happens next? How does all this help diagnose diseases?
Okay, so now comes the really cool part. Once it's identified those corresponding anatomies in both the image and the report, it performs what's called fine-grained alignment. Think of it like matching puzzle pieces. You're carefully connecting the visual features in the scan with the matching text description from the report.
So it's not just looking at the whole picture anymore. It's zeroing in on the detail.
Precisely. And this is where the power of this fine-grained approach comes in. The AI starts to pick up on those super subtle patterns that can link image features to specific diseases.
So like tiny variations in texture or shape that a human radiologist might miss.
You got it. Those tiny clues can be telltale signs of something going on.
So in a way, this AI is learning to see the world through the eyes of a radiologist.
Yeah.
Picking up on all those subtle hints.
That's such a great way to put it. And it's this ability to really connect images and text at this granular level that makes fVLM so powerful. Imagine a medical student who's not only reading the textbook, but also listening to the professor explain each concept, making those links between the theory and the actual practice.
That makes so much sense. Okay, I'm already hooked, and we've only just scratched the surface. But I think we'll have to save the rest of this amazing deep dive for part 2.
Sounds good to me. All right, so where were we? Yes, fVLM and its amazing ability to connect images and text. But there's another cool thing about it. Remember how traditional AI needs tons of labeled data? Well, fVLM kind of takes a different approach.
Different how?
It's like learning to cook by watching a cooking show, instead of meticulously following a recipe. It learns directly from those radiologist reports.
No need for all those explicit labels.
Exactly. It's not just memorizing rules, it's actually picking up on the patterns and the reasoning behind the diagnoses.
Okay, I gotta say, this is pretty mind-blowing stuff. But, and I have to ask, doesn't this open the door to a lot of errors?
Yeah.
We're talking about subtle patterns, complex medical language. What if the AI misinterprets something, or even worse, misses a crucial detail?
That's a super valid concern, and you're right, the risk of errors is definitely there. The researchers were really aware of this too, especially the danger of what we call false negatives.
False negatives, remind me what that means again.
It's basically when a patient does have a condition, but the AI misses it completely. Not a good situation, obviously.
Definitely not. So how do they deal with that?
Well, they developed something pretty clever called a dual false negative reduction approach. And a big part of that was figuring out how to deal with all the normal cases.
Normal cases.
Yeah, think about it. When you're looking at a whole body scan, finding everything to be totally normal, that's kind of rare. But if you're just looking at one specific organ, well, there are a lot more normal findings.
Oh, that makes sense. So just because my liver's looking great doesn't necessarily mean my lungs are in tip-top shape.
Exactly. So they had to teach the AI to tell the difference between these, organ-specific normal findings and the really worrisome stuff. And they did this by focusing on a specific part of the radiologist report, the impression section.
Ah, the part where the radiologist sums up their main findings.
Right. So if an organ gets a shout out in the impression section, chances are there's something going on. But if it doesn't get mentioned there, it's probably fine. That helps the AI avoid those unnecessary false negatives.
Okay, that makes a lot of sense.
Yeah.
But what about those trickier situations, like two patients with similar conditions, but the reports describe them in slightly different ways? Could that throw off the AI?
Now, that is a really interesting question, and here's how they tackled that. They actually used the AI's own predictions to help it get better.
Wait, the AI is learning from itself?
Kind of. Think of it like two med students studying together. They compare notes, and if they disagree on something, well, they dig a little deeper to figure out why.
It's like AI peer review. I love it.
It is, and that's basically what they did here. They actually trained two fVLMs and had them co-teach each other. So they'd compare their diagnoses, look at their disagreements, and that would help each of them learn and improve their accuracy. Pretty neat, huh?
That is seriously cool. AI teaching AI, that's like next level stuff.
Yeah.
But I'm guessing all this learning wouldn't be possible without a ton of data, right?
You are absolutely right. To really become an expert, you got to see a lot of cases. And that's where the researchers really outdid themselves. They built this gigantic data set of CT scans, over 272,000 of them from almost 70,000 patients. It's called MedVL CT69K.
Okay, that's a mind-boggling number of scans.
It is. It's like going from a single textbook to having access to an entire medical library.
I can only imagine.
Yeah.
So big data, clever algorithms. What about results? Did fVLM actually live up to all this hype?
Oh, yeah, the results are pretty amazing. They tested it on a bunch of different diseases, 54 to be exact, and it achieved an average accuracy of, get this, 81.3%.
Well, 81.3%. That is seriously impressive.
It is, especially when you compare it to the previous best AI. It just blows it out of the water. And it's even better than some methods where humans, meticulously labeled every single image. It even beat out models that were specifically designed just for certain diseases.
Okay, so this isn't just good, it's like remarkably good. This fVLM is starting to sound more and more like a total game changer. But wait, you said earlier that it can do more than just diagnose, something about generating reports.
Oh yeah, I almost forgot. So in addition to all this, they also found that fVLM can actually generate entire radiology reports.
Well, hold on. The AI can write the report too.
Yep, that's right.
Yeah.
Imagine that, an AI that not only analyzes those images, but also explains what it finds in a way that doctors can understand.
That is mind-blowing. It's like bridging the gap between all that complex medical data and actual human understanding.
It really is. Of course, the reports aren't perfect yet, but it's a really promising step toward a future where AI could help radiologists in a ton of different ways.
Okay, now I'm really picturing the future of radiology, and it looks pretty amazing. Oh, and you mentioned something earlier about visualizations that show how fVLM thinks. Can we actually see what it's focusing on when it makes a diagnosis?
For sure. The paper has all these really cool visualizations, like those heat maps that show how fVLM is highlighting specific parts of the scan when it detects a disease. You're basically watching the AI's attention as it zeroes in on the important stuff. And sometimes, get this, it picks up on things that even experienced radiologists might miss.
Wow, that is both incredibly exciting and a little bit, I don't know, unsettling. Like, what does it mean if an AI can see things that we can't?
It's a big question a lot of people are asking, and honestly, it's probably a whole other deep dive. But one thing's for sure, AI is going to be playing a bigger and bigger role in medical imaging.
Okay, speaking of the future, you mentioned scaling laws before. How efficient is fVLM? Can it keep getting better with even more data?
That's another exciting thing about all this. They found that fVLM is super data efficient. It's like building a tower, right? But instead of using tiny little blocks, fVLM is using these big, strong blocks.
So it learns faster and needs less data to get really good results.
You got it. That's super important, especially in healthcare, where getting and labeling all that data can take forever and cost a ton of money.
No big deal, for sure. All right, I am officially putting anatomy-specific AI reports on my list of things that sound like science fiction, but are actually happening. Before we move on, though, what about fVLM's potential for the future? Anything else that really stood out to you?
I think the most exciting thing is that possibility of actually generating those anatomy-specific reports. Right now, fVLM creates a report for the whole scan, but imagine if it could give super detailed analysis for every single organ.
That would be incredible. Imagine the level of detail.
It would be a total game changer. Doctors would have this incredibly precise information about each patient's health. It would be amazing.
I could totally see it now. Doctors at their computers,
Yeah.
looking at these super detailed AI-generated reports, all these amazing tools to help them make the best possible decisions for their patients. It feels like we're witnessing the start of a whole new era of medicine.
It really does. And this paper, it's just the beginning. Who knows what other breakthroughs are coming next?
I know, right? It's like we're on the cusp of something truly revolutionary. So let's take a step back for a second, think big picture. What does all this mean for the future of healthcare, like beyond radiology even?
Well, if we think about AI and medicine as a whole, I think fVLM is a huge step in the right direction. We're moving past just recognizing patterns and into a much deeper, more nuanced understanding of medical images. And that opens up a ton of possibilities.
Like what kind of possibilities?
Well, not just diagnosis, but things like treatment planning, personalized medicine even, maybe even drug discovery down the line.
It's almost like we're giving doctors this brand new way to see and understand the human body.
Right. And it's not just about catching diseases earlier, it's about making sure each patient gets the absolute best treatment possible. That's the whole idea behind personalized medicine, isn't it?
It is. It is. But I got to admit, all this is super exciting, but also kind of, a little bit intimidating. I think a lot of people worry about AI eventually replacing human doctors altogether. What do you think about that?
Yeah, I get that. It's a question that comes up a lot, but I honestly see it more as a collaboration, not a replacement. AI is a powerful tool, no doubt, but it's just that, a tool.
So it's more like AI augmenting human expertise, not taking over completely.
Exactly. Think of it like, I don't know, giving a carpenter a new power tool. It doesn't replace the carpenter's skill or their judgment. It makes them even better at what they do.
So instead of this AI versus humans thing, it's more like AI working with humans to improve patient care.
Now you're getting it. Radiologists could use fVLM to double-check their work, maybe spot something they might have missed, and even free up some of their time so they can focus on those really complicated cases, the ones that really need that human touch and expertise.
It's like a true partnership then, each side bringing their unique strengths to the table. Okay, before we officially wrap up this deep dive, was there anything from this paper that really stuck with you? Something that just, I don't know, left a mark?
You know, what really impressed me was how fVLM brought together all these different ideas. They took inspiration from how human radiologists already work, used all this cutting-edge AI stuff, and then went and created this massive data set to train it on.
It's like the perfect recipe for AI innovation. A little human insight, some technical brilliance, and a whole lot of data. Well, this has been one seriously enlightening deep dive. What about you? Are you feeling hopeful about the future of AI in healthcare?
I definitely am. It's a really exciting time to be working in this field, that's for sure. Who knows what's coming next, right? Maybe an AI that can predict diseases even before they show up on a scan. Or one that can personalize drug treatments with incredible accuracy.
I love that. Endless possibilities. Well, that's a perfect note to end on, I think. For those of you listening who want to learn more about all this, we've included a link to the research paper in the show notes. It's worth checking out, even if you're not, an AI expert or anything.
And if you're already thinking about your next big pile of sources, no matter how complicated or confusing they might seem, send them our way. We at The Deep Dive are always up for the challenge. We'll break it all down, find those key insights, and leave you feeling smarter and ready to tackle whatever comes next.
Absolutely. So until next time, keep those brains buzzing, keep those curiosity fires burning. And remember, the only limit to what we can learn is the limit of our curiosity.